Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
treatment of the urothelial tumors. How do you treat urothelial tumors? So in the urothelial tumors, first you should do ureteronephrectomy is done with a cuff of bladder. So nephroureterectomy. So in the nephroureterectomy, you will remove the kidney and you will be removing ureter also. So you will be doing this nephroureterectomy is done along with the cuff of the bladder. A part of the bladder is also removed. After doing this nephroureterectomy, you should do periodic follow-up is done. Why a periodic follow-up should be done with the help of cystouretheroscopy. With the help of cystouretheroscopy, you will have to do a follow-up. Why? Because the patient has a risk of bladder carcinoma and the patient also has a risk of developing contralateral urinary tract carcinoma. So in both these conditions, because the patient has risk of developing contralateral upper urinary tract carcinoma in almost 2 to 4% of cases, and because the patient has risk of developing bladder carcinoma in 30 to 50% of the cases, so we should do follow-up treatment by doing a cystouretheroscopy, and you have to visualize if there are any visible lesions on the gallbladder or urethra.
thank you and thank you for watching.